Here's my question. Regarding ulcer, we know there are different types of ulcers. What are the most common parts of the body where we humans experience ulcer, and what are the ways to prevent them?
Okay, different types of ulcer. Yes, that is obvious. But most of the two major types of ulcer is gastric peptic, although there's duodenal. Um, their symptoms are usually similar. Mm? They cut across different. They have different classical unique symptoms, but together you'll be able to know you have ulcer. Okay. Some of the symptoms, popular symptoms, is chest bone. Chest bone either before or after eating, depends on the kinds of ulcer you have. Chest bone when you're hungry or after you have eaten, depends on the kinds of ulcer you have. Then we also have indigestion. Indigestion. You have gas, which is flatulence, excess gas. You're either passing out gas as your from your anus as mess, as mess. You know what mess is, right?
Yes.
All right. As belch. All right. Or you belch it out. So those are one of the popular symptoms. Then there's pain too. Pain is also a popular symptom from ulcer, especially aggravated ulcer. Um, pain. Then there is bleeding. All ulcers have bleeding. All ulcers have bleeding. Okay, because an injury, ulcer is an injury. Okay,
Okay,
so it
yeah.
depends on the level of the ulcer. That now determines the level of the bleeding. Now, sometimes for patients when they have bleeding, they start having metallic taste. No blood is tastes metallic. You're not in your head. You've tasted blood before?
Yes.
Jesus.
Yes, like maybe
Said
your tongue. Maybe
yeah.
you
No, no, no.
Injury.
You've eaten blood?
know.
Ah, thank God. So if you don't have it in your mouth and you start feeling that metallic taste, know that, okay, there's something happening under your inside your stomach. You understand?
Yes.
Then that means that the ulcer is aggravated. Okay.
Okay.
So one way to address that is, you see, ulcer is curable. I've seen many people who think that ulcer is not curable because um, what will make you have ulcer first of all is your lifestyle. Your lifestyle predisposes you to having ulcer. So and then if you do not change that lifestyle, no matter the drug you take, there's not going to be any improvement. So you see people telling you, there's no cure to ulcer. I've taken this drug, I've taken this drug, I've taken this drug, I've taken this drug, and it's not curing. They insist that there's no cure to ulcer, but there's no way you will get a cure if you do not change your lifestyle. So, for example, you're the kind of person who abuse analgesics. Analgesics are painkillers. If you abuse them, you have to stop and they take your drugs and you'll be fine. If you're the kind of person who don't eat in the morning, maybe because you're trying to save for you're trying to save for your bends, or you have a heartbreak that you are refusing to heal up from. The girl left you 3 years ago. You are still talking about the getting now, and then you are still down emotionally. You will not heal from the ulcer. Why is that? So say, how does my emotions get to lead with? Emotions can lead to stress, and stress is one of the factors that cause ulcer. So you can eat very well, eat in the morning at least, no matter how bad it is, no matter how small it is, you can take something so that your stomach acid is diluted in a way, okay, and then you reduce stress and take your drugs. You'll see that you'll be fine if
Okay.
every other factor remains the same. Okay,
I would like to buttress on this, the predicament of ulcer.
that's okay.
Yes. So you said that ulcer can be treated, but I think one of the reasons why people have that opinion is because I've heard people say that maybe after, like, if you heal after like 10 years, then maybe you are not eating, you are starving yourself, so the ulcer can still come back. So is that true?
Yes, that's true. I mentioned that lifestyle causes it. So if you don't maintain a changed lifestyle over a period of time, it will come back. Now, let me just tell you something. Ulcer is like an injury on your skin. Ulcer is an injury. The word ulcer is an injury. Ulcer. If you have a cut here, now that's an ulcer. It's a cut. Okay, so why we are referring to ulcer internally as an injury in the stomach, because all of us have talked about ulcer, ulcer, ulcer. So none of us, we don't put peptic ulcer again. It's supposed to be peptic ulcer, duodenal ulcer, gastric ulcer. I don't know if you understand. So we're supposed to put those names behind it. Skin ulcer, leg ulcer, right? That's the word. But since we already have the idea of ulcer, now if I have an injury in my hand, and I'm a carpenter, I always nail, I always hit, and I have an injury here. If I hit that my hand with hammer once every week, if like the Arabia Boniki and they are tying that hand, the hand will never get healed. I don't know if you understand. So if I want to stop amygdala here, I will take my drug and I will stop that job. Maybe I'll stop being a carpenter.
Yes.
Okay, because okay, carpenter increases my arm to being hit with a hammer. So let me stop it. So if you want to treat ulcer, you check whatever causes that internal bleeding, and then you stop it.
Okay.
And then you take your drugs and you're fine. Thank you.